report as we welcome Brad and Carissa to the studios. Good morning. How are you guys?
We're doing well. Thank you, Randy.
Oh, thanks.
Awesome. Beautiful weather out there.
It is beautiful. It's been beautiful all weekend. We got a chance to see you at the parade.
Yeah, it's going to be another beautiful weekend this weekend.
Absolutely. Bell game Friday night. That'll be a good one.
Yes.
I'm still a little disappointed in you, Randy.
You are? Why is that?
Well, I bribed you pretty good with candy on Saturday.
Yeah.
And
I wanted to judge.
Win a thing.
You bribed the wrong table.
I bribed the wrong guy.
But I wasn't going to complain about
how many times
candy.
in history has that happened?
I wasn't going to tell you. I'm going to take your candy. So
there you go.
Yeah, you just left it at the wrong table.
You know, it was beautiful. We had a nice turnout. I was amazed.
Turnout.
Last year there were 70-some floats. This year 120-some floats.
Nah, it ended up about 97.
Oh, 97.
Yeah,
Okay, so I got a little bit.
Yeah.
Hey, still 20 extra
plus.
floats than
Yeah.
last year.
Yeah.
A lot more people out on the streets this year.
11 o'clock's a lot better time frame for people, I think.
Yeah. And great music downtown and good food.
Lots of people.
Absolutely, lots of people. So yeah, it was a lot of fun.
Yeah.
So we'll be out again this Friday night, right?
Yep, we are going to be out at the Bell game. So we should be right as you enter. So take a look. We have sunglasses for you guys, so you can watch the game if it's sunny. And then just stop and say hi. We're excited to be out supporting our community and cheering for both teams. Maybe.
I'm willing to be bribed on that.
There'll be a little bit of both there.
So a little bit of both.
Yeah.
Hey, I know. I was thinking this morning. I thought, man, if I could get a Tippy Valley shirt and a Rochester hat, and I'll wear them both at the same game.
Or you just get somebody make you a shirt.
Or do one of those halvesies.
Yeah,
I've seen those. Those are kind of nifty. My wife would probably not let me wear a halvesy shirt.
Yeah.
It's interesting.
She wouldn't allow that.
No.
You'd have to put it on after you left the house.
You know, and I am from Peru, so.
You are.
But the kids
so
around here.
So you should have black and gold then.
I do have black and gold. That'd be easy.
Yeah.
That'd be easy. That's what we'll say. Although I'm an IU guy and wearing black and gold's kind of against my rule there too.
I understand.
You know, the world we live in.
We have that same problem in our house.
Oh, do you divided house?
No, the black and gold and the red and white.
Yeah.
Yeah.
Board meeting yesterday.
You did have.
We did. Went over finances, and I think last month we talked about the idea of, to be continued.
Yes.
So to speak. We didn't have a lot of info, but we did get in our numbers for June and July, so I'll give you a quick update of both months. June we had a net loss of about $1.5 million. Now that was right when we first went live with Epic, and that was kind of expected. We purposely reduced our volumes so that we could make sure everybody had enough time to take care of patients and learn the new system. And so that was kind of expected. And then July happened and our cybersecurity event, and that took a pretty good toll on us. We did a lot better than we expected getting through that. And I think things are going to get readjusted as we move forward because we're still billing out and getting caught up on the stuff that we had to do on paper. And so I think it'll kind of help us out a little bit here in the next month or two. We'll see some changes. But overall, that month, we were down about $438,000.
Okay.
Now, what that did for us, those 2 months, is took us from being in the black to being a little in the red. And so we're about 1.6 million year-to-date in the red. So we're working hard to make that up over the next couple months. I think we'll see an increase in that or an improvement in that number just by getting the bills out the door. So, what going on paper did for us is it created a situation where we had to go back then after the fact and scan all those documents into the system, give all of those people now a new Epic number, and basically, while we're doing today's work, we were doing last week's work and the week before's work. And so we brought in some additional resources to get those scanning things done, and now we're starting to see that get billed out. Gotcha. So I'd also say then, as a patient, be aware that a visit that you may have had in late June and early July, that you may not see that bill come to you in the form of an EOB or an explanation of benefits, or an actual bill for about 30 to 45 days longer than normal, just because our process got scooted out a little bit.
Gotcha.
We'll still send you the bill, but it may be a little bit longer before you get that.
Gotcha.
And we do, we want to thank the community because I've been in healthcare 26 years. I have not heard of any organization ever who, big or small, who has had a massive change or a complete change in their computer systems, and then 14 days later have a cybersecurity event that puts them back on paper. The Woodlawn team is amazing. I was at a Indiana Rural Hospital Association meeting about a week ago, and they had heard of our cybersecurity challenges and the fact that we had just went live with our computer system, and they asked how we were doing, and I said, bring it on. Our Woodlawn team can pretty much handle anything. They got through this with such grace. Our IT team, those are people we don't normally see out in public. We kind of hide them back in the room and put them by the servers, and they were all over the place. They worked their tails off and did an amazing job of getting us back up. We're at 95%. That's a solid A. We're at 95% right now, back up and running, and so we're pretty proud of that overall.
Cool.
Yeah.
How long will it be before the other 5%?
That's a great question, Randy. I would say at least 30 days
Okay.
longer, because many of those things are not necessarily things we can do.
Right.
It's an outside vendor who has to flip a switch or has to work back through the process of building that
Through those
connection.
couple of months.
Those kinds of things. So now, from a running standpoint, everything's running. We're
Right,
good.
good.
We're good to go. But there's these little things that we have to kind of get plugged in later.
Gotcha.
And so patients won't even know those things
Awesome.
necessarily.
Perfect.
It's more on our side.
Cool.
So that kind of brings up the idea of reiterating the fact that we are on Epic now. And one of the greatest tools that Epic has brought customers, including myself, is MyChart. I cannot stress enough, if you are a Woodlawn patient of any kind, whether it be your whole family's on, or just you are on, or just your kids are on Woodlawn, coming and seeing our providers, get the MyChart app, download it to your phone or smart device, put in that request with your provider to get that email sent and get that done. That app is so smooth. It will eliminate or reduce your need to call your doctor's office in lots of situations. For example, I'm getting ready to hit one of those milestone years we were talking about earlier, right? I'm going to be 50 this year, people. I like large sums of money in electronics, if you're looking.
He's totally joking, everyone.
I am absolutely joking.
No, you're not. But it's okay.
No, I am. You can see my face. I'm joking.
Yeah.
But
You really is
what I
turning
thought
50.
was I am really,
That's not
that's
a
the
joke.
thing I'm
That's
not
not the
joking about. The app,
Mhm.
I did my kind of yearly checkup. You get your lab orders and all of those
Oh, yeah.
kinds of things, and you go do what you need to. And boy, it wasn't 24 hours later, all the results had came back into my app. I had been sent a message saying, hey, you've got something in, you've got a message from your doctor. The doctor was able to go on, see those lab results, type me in a quick message saying, hey, here's your results, here are the good things, here are the things we need to work on, all of those kinds of things. And it was so smooth. I could pull that up and look at it. I could send a message back if I had questions. It's very, very nice and very easy to use.
Yeah.
So if you need help, reach out to the clinics. We'll help you figure that process out on your phones. We are starting to go into some of the waiting rooms with some of our staff kind of randomly, and just asking the people in there waiting to go for their office visits, hey, do you have the app, or do you need us to help you? Would you like to get on there?
Yeah.
And so that's a really good thing. We are ahead of schedule, and Krista, you could let them know kind of where we're at.
Right. Yeah, so the goal that we were given by the vendor was to get to 15% in 90 days, and that did not include any of our challenges. And I'm happy to report we're at 28%. We have a lot of people who haven't activated, so if you haven't activated, I really want to encourage you to. Like Brad said, you can get results, but there's other things you can do depending upon the provider you see, but you can request an appointment. We understand sometimes our phones are challenging. We're very aware and we're working on that, but as we're working on that, you can request an appointment and it'll message the front desk, and then the front desk can message you back in a few hours. So if you're a working individual, I know it's really hard to step out sometimes and make a phone call. You can just send something through the app and then communicate back, and then once you say, yeah, that'll work for me, they'll schedule it, and then you can see that in your upcoming appointments. It also will do medication refills. It has a lot of things that make it easier for you to do without having to pick up the phone. So it's just it's an amazing tool that we have. We're really lucky to have it as well. But like Brad said, we have had people, and we're hopefully going to get more in the waiting rooms trying to help show people all the capabilities. So we're really excited about it.
Yeah, there's a little bit of work up front on the patient's perspective. Just, download the app, get signed in. If you have other organizations that you go to for healthcare, if they use Epic, you can connect those accounts so that you could see all of them in one location. The other thing that it does is if you get that and connect, it allows your doctors to see more information too. And so they can help you a little bit better.
Yep. It's awesome.
Yes, very much so. Another thing I wanted to remind everybody of is that we have a new model of how people get admitted in the hospital in the evenings. And we talked really briefly about it last month, but we call it a nocturnus program. But basically it is a doctor at night who helps coordinate your admission between the emergency department and the floor. And it is someone that's available via telemedicine, and all that information gets put in. They get your orders taken care of, make sure you have the same home medicines you had, and all of those kinds of things. So it's just a little more seamless. It allows all of that to be done in the evening so that nobody's waiting on care. And then in the morning time, when the hospitalist program, which is our nurse practitioners that work there on the floor, or if you're seeing, let's say, one of our surgeons, Dr. Sheedy, Dr. Hawk, Dr. Nile, those providers, they can come in then the next day and do rounds and take care of anything additional. So it just speeds up the process. Main goal is we don't want anybody to wait in the emergency department any longer than needed if there's someone who should be taken care of at Woodlawn up on the floor.
Gotcha.
Get you out of the ER, get you into a bed where you can be a little bit more relaxed and out of the bright lights of the ER, and get your medication started and those kinds of things. So it's just a little bit better improvement of overall care. So that's been going about a month now. It's going pretty well.
Good.
We always got things to work out, and then of course right in the middle of that, what do? We started a new EHR, and then we had a problem. Yeah. But overall, they are doing an amazing job.
Good.
So we're very happy about that. And then really the only thing I wanted to go over is making sure that we let everybody know where we're going to be and when.
Yeah, we have been out and about, and I'm so proud of our team for all that we've done this year. We've been almost, I feel like every parade in Fulton County we've touched, except Kiwanis, but no worries. We'll be out there next month. As Brad mentioned, we'll be at the Bell game as well. I'm sure both of our staff is cheering on both sides. Go Valley. I have to say that my son goes there. And then my last thing is we had the Boo Festival and the Akron Argus Halloween as well. So we have those going on, and then we have some teams who will be helping out with the Boo Fest. We're not doing the chili cook-off, but we have some hopefully we'll have some teams out helping do that community event. We know that's a big deal here in Rochester. If you want to know what's happening within our health system, we have our Facebook page and our Instagram. We have some fun things running right now. We have a Operation Challenge, so those should be coming out on Friday. I'm not sure we're going to get one out this Friday, but different departments are playing the game of Operation, and the goal is we will have an Operation Champion. So tune in on Fridays and watch.
We might need to bring that in here next month, Randy, and see how you guys do on those fine motor skills.
Yeah, probably not very well.
Absolutely.
I never played well as a kid.
You didn't do Operation well as a kid?
No, I got buzzed a lot.
Okay, well.
I think the funniest one to date, we just aired on Friday, so go watch it. It's with our materials team. It's epic.
Yeah.
And then other than that, we're just so grateful that this community allows us to earn the right to care for you and your families. We never take that for granted. So thank you guys so much for having us on.
Absolutely.
Has the administrative team done it yet?
Oh no, we need to.
That's a great question, and
that one will
that
probably
has
get a lot of views.
Not happened yet.
That
there could be some rivalry in there.
There could be.
There could be. I'm pretty good at it.
No.
You guys.
I think you just challenged some people there.
I'm not saying that, and I didn't bring it up. But I'll give you your money later, Randy.
Well, we might know what the next team will be videoed.
I think that'll be a lot of fun.
Yep.
Krista will have to play. Our HR director, Chief
all
of HR will have to
administration,
play.
yeah.
Our CFO, Carrie Bowers, call her out there. She'll have to play.
Yeah.
Alan,
I don't have fun.
We only
Kathy
have 3
Lau.
boards.
Yeah.
We'll
we
have
get a- we'll
rounds.
have to-
You have to do it in rounds.
2 rounds of 3.
Yeah.
You do 2 people each time, or
There
3
you
people
go.
each time.
Perfect.
It's a little tiered thing. We'll get it down to the winner of the area. Yeah.
That sounds like a challenge.
Absolutely.
Well, guys, thanks for coming in. Appreciate it. Enjoy the weather, and we'll see you Friday night.
Sounds good.
Goodbye.
Woodlawn Health Report here on Giant FM.